For the record, I'm Senator Bruce Starr. I have the opportunity to represent Western Washington County, Senate District 15, here to testify in support of Senate Bill 538. Madam Chair, members of the committee, I really appreciate you scheduling this bill for a public hearing. When I filed this bill, I will tell you that there are very few bills that this legislator has filed that has generated so much public interest so quickly. And I think it's one that hits a nerve with Oregonians and Oregon taxpayers. And my email inbox and my phone was ringing off the hook with stories of folks that were observing, seeing members of their community that they believed were on public assistance, but also taking illicit or illegal drugs. And that really grates, I think, on the average taxpayer and the average Oregonian when they believe that their tax dollars are being used in a way that, one, they don't support, and two, is damaging to the user of those tax dollars. The state of Oregon has a stipend for individuals who are out of work or have fallen on hard times. This public assistance is intended to meet the immediate and basic needs until those individuals can get back on their feet. It helps families buy groceries, pay for health care, and keep the lights on. I'm concerned that some individuals may be using Oregon's assistance program to supplement a drug habit. This isn't just a misuse of tax dollars, but it empowers individuals to continue in behavior that is destructive to themselves and to their families. Oregon's assistance program should never, ever be used to facilitate this type of behavior, nor should we as policymakers tolerate it. Senate Bill 538 would require all applicants for public assistance to take a substance abuse screening test. This written test would ask a series of questions based on the responses is accurate, and it is accurate in identifying individuals who are likely abusing drugs. An individual who fails the test would be required to take and pass a drug test in order to qualify for public assistance. This type of safeguard makes sense. It ensures that tax dollars are not being used to supplement an illegal habit and are going to individuals and families that are truly needing, truly hurting, and in need. It will also hopefully help identify individuals who are held captive by addiction and provide an opportunity to get them treatment and help. And I should have mentioned that we have a -3 amendment that significantly narrows, and I hope that you have copies of that, but significantly narrows the original bill. The original bill has been passed in other states and it's been taken to court, and the courts have proved it to be, or ruled it to be unconstitutional. So we, working with the Department of Human Services and others, significantly narrowed this bill, narrowed it in scope. We believe that we have a bill now that, one, meets constitutional muster, and two, is workable, and really addresses the core target audience, target populations that we are going after. The bill also, or the amendment also, recognizes that the department may have to ask the federal government for a waiver, and so I think when you hear from the department, they may mention that. The amendment contemplates such a situation and would authorize DHS, the department, to solicit such a waiver from the federal government. So with that, Madam Chair, members of the committee, again, I appreciate you holding this hearing. Again, I think this is an issue that Oregonians would understand. I have talked to a number of them. I've been probably maybe had more media interviews on this particular proposed bill than maybe any other, and people understand it. They get it, and I hope that we can too and address this issue. I again commend you for holding the hearing. I'm stand willing, able, and ready to work with you if this concept needs further massaging to make it work. But I do believe that it's an important piece of legislative work that needs to happen. It needs to happen this session, especially in light of kind of the economic circumstances that too many of our friends and neighbors are experiencing. Thank you.
Thank you very much, Madam Chair. For the record, my name is Betsy Johnson. I'm privileged to be the state senator from District 16. I'm here in bipartisan support of this bill, and I echo everything that Senator Starr has already put on the record. These programs are bridges to self-sufficiency, and drug addiction is antithetical to that outcome. My interest in the bill is to help maintain healthy families. I know that there is a paucity of resources for the addicted, but someone genuinely seeking assistance starts with the realization, either self-actualized or forced, that there is a problem. I think this bill is a good start. We would still have a requirement, I believe, to work to find more services for people that are addicted, but for all the reasons that Senator Starr has already put on the record, I come today with him in bipartisan support of this bill.
Thank you. I have some questions. The concern I have is, having worked in public health, worked with a number of families who are getting public assistance, the child is always put first in my eyes. And so we certainly wouldn't be doing screenings on children, but sometimes it's tough getting these parents straight. And the threat of having their child taken away sort of helps motivate some parents from going off. But I have a concern about the children who may unnecessarily be taken away from parent when the parent is trying to be compliant. They fall off the wagon, but then they get back on, and that's just one piece that I have concerns about. Do you have a reaction?
I would speak to it on two accounts, Madam Chair. I don't think it's just the children. Also, in anticipation of this bill, Senator Starr and I were approached by a constituent who indicated that he appreciated the legislation, but also wondered about elderly in nursing homes, assisted living, and foster care currently on public assistance. And the elderly would be an issue here, too. My belief is that a child living in a drug-addicted environment is in serious trouble already. And I understand I don't understand because I've never experienced it. Intellectually, I try to understand the vice grip of drugs. But a motivation to break that vice grip, I think, ensures a healthier environment down the road for the child. A child in a drug-addicted home already has huge problems.
Yeah, I mean, I think that would be my response to the question is, my hope is that because we would pass legislation like this, we would have fewer children who are growing up in drug-addicted homes where their parents are addicted to drugs, where because of this program, we're able to identify moms and dads and refer them to treatment so that we can save those kids. Those kids are worth saving.
Mm-hmm. But we refer them to treatment centers, and then they're monitored for compliance, and then if they don't, then of course DHS steps in and see, if they can't comply, and the children are removed. So I'm just looking at from when we first get the referral and then we get them into treatment. Just a little gray area that I feel needs to maybe be cleaned up a little bit. Senator Bates.
A couple of questions. I'm trying to read the bill quickly, and there's some dash 3s out there which I haven't seen, so maybe it's covering the dash 3s.
It's a gut and stuff, so.
Well,
okay.
Maybe I shouldn't even ask any questions yet then.
Yeah, do you guys have copies of the dash 3s?
Yes.
Yeah, we just got them.
Okay. Yeah,
we have a chance to digest. Before I ask any questions, let me
it significantly narrows the scope of the bill.
Okay. Yes, Senator Cruz.
I appreciate Senator Johnson's comment about trying to understand that situation. I do, because I've been there. And somebody that's addicted to drugs, it requires a thing called tough love. And one of the things you have to do is break all of the spokes of their wheel that are enabling them to continue to operate the way they're operating. And to a large degree, the state is an enabler of people to stay on drugs. and as long as you have, I mean, you can have a wheel with 8 spokes and you can be down to 1, and you're still going to keep trying to roll that wheel. They all have to be removed, and so really, I've tried to do legislation like this for a few sessions. I'm not as elegant at this as Senator Starr is, obviously. I would like to see this moved and see the department start working on it and start working on a waiver from the federal government. As it turns out, this session or the next year or so, we may be asking CMS for several waivers on several different subjects. So I think we'll have a good pipeline there. But quite honestly, Madam Chair, this is the best thing we can do for the people and their kids long term. Short term, it's hard, but that's why it's tough love. But as long as we keep perpetuating this, nothing's going to change.
And just a comment, we have, since I'm getting into Ways and Means and Human Services, public assistance covers just about everything. I think food stamps is the from the feds, so we don't have anything to do with that. But what about employment-related daycare, which we just heard today?
So the bill narrows the assistance to temporary assistance for needy families or supplemental nutrition assistance, and so those are the two areas that we've narrowed the bill to.
The WIC program?
Temporary assistance for needy families, and it's TANF and SNAP.
Yeah.
Oh, it's TANF and SNAP.
Yeah.
Okay.
Everybody knows the acronyms more than reading it out.
Okay.
So.
Well, again, I'm still thinking of these children.
Well, we're both thinking of the children.
Who will then be, well, they'll be put in foster care. Probably we would have more in foster care. But let me read the -3s because I haven't done that yet.
Thank you.
All right.
And I appreciate the hearing and the opportunity to testify. We have spoken with the Department of Human Services, and the -3s were crafted in response to their concerns about the -2s. So as you know, that's how this process goes. I'd also like to recognize the staff and the Matt Lawrence in the Senate Republican office, who has been really helpful as we've worked through this process. So
Great.
thank you.
Thank you.
Thank you.
Very much.